Okay, can I have the syringe, please? Here we go. 1, 2.
I had a 22-hour surgery to remove 3 vertebrae in my neck. That was a really hard thing to recover from.
When I was less mobile, it affected my mental health, it affected my quality of life.
I asked the question to myself, have I done enough good memories that my family will cherish if I pass away? And the answer is no. My answer is no, and I said, I gotta live. I have to live.
The Vancouver General Hospital and UBC Hospital are really the center in British Columbia where almost everyone comes for complicated tertiary and quaternary level surgery.
If you're involved in a major car crash, you're going to be flown here. If you need a liver transplant, it's going to get done over here.
The challenge we have now is that our operating rooms aren't universal. We use multiple techniques to save those patients' lives, all requiring high technology, multiple personnel.
We need better ORs that are bigger, that are more technology enabled, that allow us to do what we need to do.
I used to work as a nanny, and I was taking care of a 2-year-old boy. And I had him on my shoulders a lot, and I thought I must have hurt myself doing that because I had really acute neck pain to the point where I couldn't turn my neck at all, and I literally had to roll out of bed. They saw a shadow in my spine, and it was cancer.
The treatment plan, especially in Michaela's case, is very, very demanding on the patient.
I've never experienced anything in my life quite like chemotherapy. It just rattles your entire body. I had a 22-hour surgery to remove 3 vertebrae in my neck and put a piece of my pelvis there instead. That was a really hard thing to recover from.
When we take the tumor out, there's nothing supporting her head on her body anymore, so we have to reconstruct her spine to hold her head back on.
I had no sense of my own mortality, but when it's right there, it really changes something about your psychology. It just becomes about survival.
For the patients and for their families, that's one shot. They only have that one opportunity. If it goes sideways or it doesn't go right, there's no way to retrieve that. It's not a fixable problem. So it has to go right every single time.
About 3 years ago, I noticed that when I jogged or when I was at the end of a golf game, my left hip was hurting. About 3 or 4 months later, I started to develop pain in my back and pain going down my leg. And that was quite bad. Whenever I was standing, I would have to lean against things. So in retrospect, I was quite disabled. For a man my age, it was affecting my quality of life a lot. And ultimately, I was diagnosed with a cyst on my spine. My first surgery was at VGH. My second surgery was a hip surgery done at UBC Hospital. And the staff at both places were highly professional and very kind.
At the UBC Hospital, we have designed the future of surgery to put in place a facility that allows for efficient care of patients who have less acute problems so that their surgery can proceed without interruption, without being bumped by emergencies, and where they don't have such intensive requirements for medical care before and after surgery.
It pays to go to a place where they're doing a lot of the procedures all the time. And now I'm completely back to normal.
In 2013, I started having dry cough. I'm having a hard time climbing up the stairs, taking out the garbage. I saw a respirologist in March 2015, and she said, this is IPF.
He was referred to us with a condition called pulmonary fibrosis. It leads to progressive scarring in the lungs. We do not know what the trigger is.
Patient diagnosed with this disease only has 2 to 5 years to live. And I look at my kids and you started thinking about, okay, what's gonna happen here?
During his wait for a lung transplant, he suddenly deteriorated and essentially came to the hospital in free fall. There was no donor readily available, and we had to make a decision as to whether or not we can keep him alive, even through the night.
The doctor came in and they said, there's a possibility that there's a matching donor and you may go surgery tonight.
One double lung transplant was done in 2002. In 2016, we've just done our 38th double lung transplant. Willie had a fantastic outcome. You can see the impact it makes on not only a patient's life, but their family.
The biggest need for the Future Surgery campaign is to have operating rooms that are optimally designed for today's technology and also in anticipation for what the future is going to be like.
This is really the flagship institution for surgery in British Columbia, and so we want to be on the cutting edge and we want to be innovative.
The philanthropic giving that would make these ORs a reality is the perfect expression of our community rallying together.
When we're thinking about the future of surgery, what we're really talking about is building a facility that allows us to provide the best possible care for our patients.
Vital starts right here.
Vital starts right now.